Doctor's in, and today we are discussing breast cancer. It is the most frequently diagnosed cancer in women after skin cancer. More than 200,000 women will be diagnosed this year, and you may be wondering if you are at risk, and if so, what steps can you really take towards prevention of breast cancer? Dr. Scott Ackerman is one of the First Coast's leading oncologists. He is here today to talk about those risk factors. Dr. Ackerman, thank you again for being here, and this is something I know that a lot of women think about, you know, and it's a very scary reality, and a lot of women, we know someone who has either been diagnosed or unfortunately has lost their lives to breast cancer. So we're always in tune with trying to do everything that we can to prevent breast cancer. Are there any factors that we cannot control but increase a woman's chance of getting breast cancer?
So breast cancer is a very difficult disease because there's so much of it, so much of breast cancer is outside of a woman's control. With lung cancer, we can not smoke to reduce our risk. Bladder cancer, not smoke as well. We cannot expose ourselves to certain chemicals to prevent other cancers. But with breast cancer, there's not a whole lot that we could do to prevent it. There's only things we could do to diagnose it early. So it's important to know if you're at risk for breast cancer. And there's certain things that would put you at risk. And now the things you can't control are mainly your genetics. The genes you were born with, whatever genetic defect you may have or whatever genetic predisposition you have, that's what it is, and you can't control this. So we know that men and women both have breast tissue. Women have a lot more of it than men, but men can get breast cancer too. But women are 100 times more likely than men to get breast cancer. And in women who get breast cancer, over 2/3 of them are women who are 55 years of age or older. Now, the converse of that means that 1/3 is younger, and I see plenty of women in my practice who are well under 55 who are diagnosed with breast cancer. I see lots of women in their 30s and their 40s diagnosed with breast cancer. There's another gene mutation that we've identified. You know, in the whole analysis of the human genome, we have found certain genes that have been associated with breast cancer. We think that there are many others we have not identified yet, but two genes are the BRCA1 and BRCA2. We call them BRCA.
Oh yeah, I've heard the BRCA analysis.
Right,
yeah,
exactly.
Right.
So BRCA1 and BRCA2, BRCA genes, these are related to a higher risk of breast cancer. And in fact, if you have the BRCA gene 1 or 2 that's positive, you have around a 70 to 80% risk of developing breast cancer sometime in your life. So I saw a woman just Wednesday, and she had a family history of breast cancer. She saw her doctor and had the testing done, and she was BRCA1 positive. So she's been following she's been getting mammograms, you know, every 6 months, every year, and sure enough, she was recently diagnosed with breast cancer.
Wow.
So it's good to know that, so you can be diagnosed early. Also, menstruation and reproduction. Women who have their first menstruation before the age of 12, or who have their last one beyond the age of 55, so longer years there of uninterrupted estrogen production, have a higher risk of breast cancer. Women who have their first child later in life. We compared women who had their first child before the age of 19 compared to those after 29, but the truth is it's a continuum. But if you have your first child at a younger age, you're at lower risk for breast cancer than if you have a child at an older age. And if you never have any children, then you're at a little higher risk as well. Also, family history plays into it, and so I mentioned the BRCA gene. That's a genetic. That's genetic, and that's passed on from your parents. There's other things too. So if your family history of breast cancer, it may not be BRCA related, but it may be related to something we haven't identified yet. Also, your race. Caucasian women are at higher risk than African American women. And breast density is part of it as well. It's hard to find breast cancers in very dense breasts.
So, and those are some of the things we have absolutely no control over.
Right.
So are there things that we do have control over that we can change or adjust in our lives to help prevent breast cancer?
Right, there are some things we could do. First of all, we do know that that breast cancer has a soft relationship. Not real strong, but there's a soft relationship. A number of studies have shown that excessive alcohol consumption is related to a higher risk of breast cancer. So I recommend limiting your drink to 1 or 2 drinks a day, but 3 more drinks a day has been shown to put you at higher risk for breast cancer. Obesity and being overweight, especially after menopause, increases your risk because the obesity causes you to produce more estrogen. So after menopause, you're obese, you're still have estrogen production. That estrogen production could stimulate breast cancer cells from growing. This would increase your risk. So I recommend trying to not be obese, also physical activity to help as well. But that's really all we can do, and that's not even great stuff that we can do. It's all good stuff, but it's not. That's not going to absolutely minimize your risk.
Yeah, and there are a lot of misconceptions that you see about breast cancer. People coming in and thinking that they know this, that, or the other about the disease, and they're
so
way
I
off
hear
base.
all the time from women. Women have large breasts. They say, well, you know, I'm at higher risk for breast cancer because I have so much more breast tissue. That's not true.
Sure. Okay.
That's not true. It doesn't matter what size breast you have. Just because there's more breast tissue doesn't mean there's more of a chance of getting breast cancer. But also women are concerned about breast implants. A lot of women have breast augmentation these days, and but rest assured that that does not increase your risk of breast cancer. It used to make it more difficult to screen for breast cancer. The implants, breast augmentation, and even breast size makes it a little bit more difficult to screen, but it doesn't put you at a higher risk. And nowadays, we're very good at doing breast cancer screening. Our mammography, our mammograms are very good, and even if you have a breast implant in, we can do mammograms properly. If you have large breasts, we can do mammograms properly.
Well, let me ask you that, because what kind of tests can we proactively do to try to limit you know, the chance of getting or catching it early, I should say.
Right, so these tests won't prevent breast cancer, but it'll help us diagnose it early and where we can cure it. Because if breast cancer is diagnosed early, the cure rate is well over 90%. So I recommend following the American Cancer Society guidelines, the screening guidelines, which is doing a self-examination every month of your breasts, getting a clinical breast examination every year, meaning getting it from your physician, and also getting an annual mammogram starting at age 40. This is the American Cancer Society guidelines. There are some other guidelines out there, but I recommend beginning in your first mammogram at age 40 and then annually thereafter. And if you're at high risk, because you have a parent, a mother with breast cancer, or other first-degree relative like a sister, you may want to consider getting your first mammogram a little bit earlier, like at age 35, and then if that's okay, start it annually after 40. Also, like the gal I talked to you about earlier, you can consider genetic testing if you have a strong family history of breast cancer.
Yeah. All right. A lot of options, a lot of good information. Thank you, Dr. Ackerman.
You,
we appreciate you being here and your insight and sponsoring this segment. Dr. Ackerman is with us every Friday. For questions regarding today's topic or any other health questions that you might have, just visit firstcoastoncology.com. Confidentially submit your questions to Ask the Doctor.